What's up everyone, Dr. Nate here. Today we're going to talk about pacing yourself with exercise using the rating of perceived exertion scale. If you constantly are flaring yourself up, if you're constantly dealing with pain and injury, you need to understand this chart. Okay, so I know a lot of people are all or nothing, and all or nothing is not helpful. Now, being all or nothing, when you're able to push yourself and you're able to really get after it, that's very important. It means that you are comfortable being uncomfortable, but at the same time, it can cause more issues. So let's go into it. So up here, the 10, maximal, means that you are giving 100% effort. It's really difficult. And if you're constantly always in the red, it's like you're flooring it. It's like you are putting the pedal to the metal. Yes, if you're in competition, if you have a very difficult workout planned, totally reasonable to be doing that. And you should be training hard in order to tolerate that. But what I notice a lot of people do is that they will go from here, they'll be at rest, or they'll be doing really easy workouts, and all of a sudden they'll jump up to maximal, and they'll do maximal over and over and over and over again until their body breaks down. Think about it this way, a professional athlete is not training at 10 all the time. They're just not. They have rest and recovery, and that rest and recovery is just as important as working maximally. And working within this 7 and 8, even 9 range is going to make it so that your training is much more sustainable and that you can actually tolerate the 10s, and that you're going to be able to train for longer and make longer term progress rather than having this constant cycle where you are able to train for 2 months and then you're injured, and then you train for 2 months and then you're injured, and you don't actually make long-term progress without avoiding injury. So this is a good way to auto-regulate yourself with your workouts. You can also apply this to dealing with pain. So if you're constantly in the red and you don't know how to pace yourself, then you're going to push through your threshold, your pain threshold, and flare things up. So it's really important to understand this chart. If you have a lot of pain, you probably want to be hanging out in the easier, like the green to lower yellow ranges, doing things that you can still feel like you're getting your respiratory rate up, so you're breathing a little bit harder and your muscles are getting tired, but not to a point where you're maximally pushing and causing more flare-ups. Ideally, everyone gets to a point where we can work really hard, but sometimes it takes longer than others depending on how long you've been dealing with something. Please like this video and subscribe to my channel. You can also, and you can hit the little button below. There's also a link below in the description for a Facebook group that I have. There are currently about 2,000 people in there. At the time of making this video, it is a group to help support you if you're dealing with lower back pain and just getting back to exercise. As always, stay strong and resilient, and I will catch you on the next video.